Another important national leader with us is Dr. Shepard. Dr. Shepard is a trauma surgeon. He's a medical director of trauma at St. Francis Hospital. He is a leader not only in LA County, but in the country, and a visionary in terms of leveraging the work, the focus on not only saving lives, but preventing that from moving forward by connecting with others in the Department of Public Health, connecting with others in the hospital, and connecting with other hospitals to join forces, connecting to help to make a difference and recognize that we can prevent violence and we can do something about it beyond just taking out the bullets and saving the lives. And so Dr. Shepard has been there in the trenches, continues to be there. We are so thankful and honored to have him here in these times that are challenging, and still they're able to help to give us the impressions and some wisdom and some insight that will help to take us to the next phase of this program. So please help me to welcome Dr. Shepard.
Can you guys hear me? Okay. Good evening. It's certainly a pleasure to be here tonight, to have the opportunity to talk a little bit about some of the things that I do and some of the things that, I'm seeing treating gun violence. I'll leave some of the conversation for the panel discussion. I have to be honest, I'm in a bit of professional discomfort or discourse. Dr. Prothrost had mentioned her experience. Fernando was mentioning that. Currently, we're seeing an upspike in the violence in the communities that I serve. And it is leaving me in a state where the words probably won't come easy tonight. So for that, I apologize. It is difficult and challenging to talk about this issue and realize that it is a public health issue. It is an issue that is a racial issue, a class issue, a mental health issue, and we have been discussing this issue for years, and it seems that we continue to stall in terms of our progress. The process for me began probably about 15 years ago. I had finished my residency and my fellowship in Baltimore, and I came here to sort of work in the community and see if I could give back. And at that time, my focus was simply on treating the individuals and saving lives, and I thought that was my sole responsibility. I would come to an underprivileged community and save lives, and that was my way of giving back. But time after time after time, we would have patients who would arrive. Can you hear me? How about now? Can you guys hear me? Perfect. Okay. So time after time, I was experiencing some very difficult conversations with families. A lot of people ask often, what is the most difficult thing about being a trauma surgeon? Is it the operations? Is it seeing the blood? It's not. It's that 2 to 5 minute walk from either the ER or the operating room to talk with the family and tell them that they've lost a loved one, usually to senseless violence. And that's the hardest conversation to have. And for me, it began, as I said, 15 years ago. There was a young man who presented actually on Mother's Day, which is absolutely unfortunate. Any day is unfortunate, but Mother's Day, obviously, a little bit more. He was a victim of assault, rifle fire, was hit by AK-47, arrived at what we call a traumatic full arrest. Means he had no vital signs upon arrival. He underwent an ED thoracotomy. We were unable to salvage him. He had a hole the size of a golf ball in his left ventricle and essentially bled his entire volume into his right chest. As we sat there, sewing up this man, we were told that his family had arrived and it was time to sort of have our conversations with the family. And as I walked out to talk with the mother, she could see on my face what the conversation would be. And it was clear that she had experienced this before. Even before I could tell her what happened to her son, she dropped to her knees and she let out this curdling scream that can pierce your soul. And as she turned around, on her back, it said, "In memory of," and it had another son's name. And I come to find out that she lost 3 sons to gang violence in a period of 3 years. And so that began the quest at St. Francis sort of to try to prevent those lives from hitting our doors. I wanted to prevent many of my colleagues from having that conversation. I appreciate the work that Dr. Prothostif has done and certainly Fernando. They did an excellent job in framing sort of the national and the local conversations and sort of and some of the things that I was going to say tonight. So I decided to sort of alter a little bit what I was going to talk about. I'm probably going to end it there. I'm going to save some of the conversation for the panel. And I appreciate everybody coming out tonight. I think that I'm going to need a little bit of help from you guys. I'm going to need a little bit of hope from you guys because we're hitting some troubling times. We anticipate a significant surge this summer, and I need a little bit of positive energy and a little bit of hope. So let's have a present conversation. Let's strip it down. Let's talk about some of these things that are holding back sort of the development and the success of America. And let's have that uncomfortable conversation tonight. Thank you.